Every headline says Ebola, but that word can hide a lot. Today, why the species you're looking at can decide whether there's a vaccine in the room at all. If you're just joining us, this DRC outbreak, the Bundibugyo strain, has been centered heavily in eastern Congo, including Mongwalu. Earlier reporting noted some patients being discharged after treatment, but clinicians were still worried about case growth. Since then, the picture has been difficult field conditions, ongoing treatment needs, and a transmission risk that just hasn't let go.
This is Ebola Watch. So today we're slowing down for the dumb on purpose question. When a report says Ebola, are we even talking about the same virus? And what does that mean for a pastor in Mongwalu trying to explain it to a grieving family? When coverage calls this a Bundibugyo outbreak, I keep seeing Ebola attached. So is this the same virus we've heard about for decades, or is something genuinely different going on here?
Yeah, and it's worth slowing down there because the shorthand really can mislead. Ebola is actually a family name. There are multiple distinct species underneath it. Bundibugyo Ebola virus is one of them, related to but meaningfully different from Zaire Ebola virus, the strain that drove the large West Africa outbreak most people remember. Per CEPI, Bundibugyo was first identified only in 2007 in western Uganda, so it's been studied much less than Zaire. And that research gap matters right now. As both MSF and Gavi have reported, there's currently no licensed vaccine and no approved treatment specifically for Bundibugyo. The vaccines we do have, the ones that proved effective in previous outbreaks, were developed against Zaire Ebola virus, so scientists are still working out whether they give any meaningful cross-protection here. Diagnostics are part of it too. Tests have to be calibrated for the right genetic target, and a Zaire-optimized test can come back falsely negative on Bundibugyo. The MMWR notes from the field, published June 11th, flag this species distinction as central to understanding the response gaps facing DRC and Uganda right now.
So, when officials say they're testing treatments, are patients actually receiving experimental drugs, or is this still mostly at the drawing board stage?
From the sources we have, the straight answer is countermeasures are still unlicensed for this species. Per the NPJ viruses analysis, that lack of approved options is one reason this outbreak is being treated as especially concerning. The thing to watch is whether any Zaire-era therapeutics or vaccine candidates get emergency authorization for Bundibugyo, and how quickly researchers can produce the efficacy data behind that call. This one's from Christianity Today.
Healthcare workers and pastors such as Delanga are fighting to keep their communities safe as the novel Bundibugyo strain of Ebola, which has no approved vaccine or treatment, outpaces attempts to stop the spread. International aid cuts in Africa, the ongoing conflict in Congo, and cultural distrust of health authorities have hamstrung the region's early warning systems and slowed containment of the virus.
Christianity Today gives us a name and a face this morning. Dennis Delanga, a pastor whose church network runs straight through the epicenter. His niece in Mongwalu died from the virus in May. One church member in Mongwalu has been in treatment for 2 weeks. A health worker in Bunia tested positive on May 22nd and recovered in 3. And the Mongwalu church itself is closed.
And this lands right on the piece we just unpacked, the strain. Delanga says there's no treatment and people are dying like grasshoppers. That's the gap in human terms. Bundibugyo, no approved therapy. So here's the trust problem. If the headline just says Ebola, a grieving family in Mongwalu remembers stories about vaccines from years ago. How does a pastor explain why that dose isn't coming for this strain?
Right. That's what the article adds. Pastors aren't just praying, they're fighting misinformation. And in past outbreaks, distrust of outsiders slowed containment. A trusted pastor can become a contact tracing asset.
Which means the accuracy problem and the body count aren't separate stories. Get the word wrong in print, and you make Dalanga's job in the pulpit harder.
If you have feedback, story ideas, or corrections for Ebola Watch, we want to hear from you. Send us a note at ebolawatch@lanternpodcasts.com. We've put links to every story from today's briefing in the show notes, so you can follow up on the pieces that stood out or read the source material for yourself. That's Ebola Watch for today. This is a Lantern podcast.